Morning, my name is Bogdan Simanda. I am a member of the DDS class of 2021. My lecture today is entitled Indirect Pulp Capping in Primary Teeth. Is this the primary tooth pulpotomy out of date? So this is a literature review, and our objectives are to look at vital pulp therapy choices, the stepwise caries removal method, and look if pulpotomy is an indication for caries exposure, diagnostic methods for identifying teeth that are candidates for vital pulp therapy. As well, we'll compare primary tooth pulpotomy with indirect pulp therapy. Before we start talking about vital pulp therapy, we should look at the stepwise caries removal method. This is a method that is proved to be very useful in cases where pulp exposure was suspected based on radiographic investigation. So it's a procedure that aims to minimize pulp exposure and preserve vitality. And it's done in 2 appointments. So let's look at the picture. In picture A, we can see the tooth with the caries. In picture B, we can see that caries were removed at the periphery, but left in the central area. Then it's covered with a layer of calcium hydroxide and a temporary filling on top. And this is left in for 6 to 12 months. After 6 to 12 months, we can see that the dentin has retained its, it's still demineralized, but indicates a slow progression of the lesion, as demonstrated here by this darker color. Then the filling is removed and the final restoration is performed. Now the advantage of this method is that with the use of this method, approximately 80% pulp exposures were experienced versus 40% with conventional caries removal. So it can be concluded that stepwise caries removal will result in fewer pulp exposure than total caries removal performed in 1 visit. Now, pulpotomy is done to when the pulp is being exposed. So all carious dentin has to be removed, and then the pulp is amputated. As we can see in the picture above here, we have a tooth. All the coronal pulp was removed, only the radicular pulp was left, and a medicated filling was placed. And this can consist of 3 main materials: formocresol, ferric sulfate, and MTA. So what formocresol does, it fixes and desaturates the pulp and makes the pulp inert. In addition, it also has a bactericidal action. On the other hand, ferric sulfate creates a blood clot that acts as a barrier and creates mild irritation that might help preserve the deeper pulp. MTA, on the other hand, encourages the remaining pulp to heal and form a dentinal bridge. So the purpose or the objective of pulpotomy based on ADA's guideline is to keep the remaining pulp healthy, asymptomatic, and without clinical or radiographic evidence of internal or external root resorption. The table here shows the success rates with the 3 different materials. So the MTA has the highest success rate, ranging between 91 and 100%, and followed by formocresol and ferric sulfate. What are some of the conditions to have a successful pulpotomy? Well, first of all, the pulp must be vital. Teeth with a carious pulp exposure have a reduced chance to have a successful pulpotomy, as the likelihood of being totally vital is limited. This stepwise caries removal will result in fewer pulp exposures than caries removal performed over 1 visit. Performing a pulpotomy on teeth without carious pulp exposure is likely to increase the chance of displacing infected dentin into the pulp and impairing the pulp's repair capacity. It also works best when the carious lesion is at least 1 millimeter or more away from the pulp. So what are some of the concerns though? Well, it has been noted that 35% of the cases treated with formocresol had an earlier exfoliation, which was more than 6 months than it was supposed to be. And also, formocresol contains formaldehyde, which was categorized by the International Agency for Research on Cancer of causing causing nasopharyngeal cancer rather. So based on the data collected from insurance companies, has been shown that dentists have charged 2.3 times more for pulpotomies than for indirect pulp therapies. This is probably because indirect pulpotomy is not covered by any insurance schemes. And also, the procedure of pulpotomy can potentially be painful because it involves anesthesia as well as very well touching the pulp, which we know is painful in comparison to indirect pulpotomy, which doesn't require anesthesia or pulpal entry, so it's potentially less painful. Indirect pulp therapy, on the other hand, it requires no anesthesia. The excavation can be done with a spoon or with a number 406 round bore on a slow speed, and caries close to the pulp are left in place, as we can see here. And then it's covered with calcium hydroxide or other biocompatible materials, and temporary filling, which will prevent micro leakage. It's not indicated in case of pulp exposure. In case of pulp exposure, we have to go directly with pulpotomy. There's no other choice up to date. So indirect pulp therapy was proved to be successful in more than 90% of the cases, regardless of the medicament that was used or the technique, the length of time that was observed for, even when they compared students with experienced dentists. The key really for success was a good seal against micro leakage. Glass ionomer caries control is a method that can help us identify those teeth that are still vital. Is it crucial for deciding which one of the two methods we will use on our patient? So the glass ionomer caries control method is used for identification of teeth that are viable for vital pulp therapy. There is no anesthesia needed. As we see here in picture A and B, these are pre-op pictures. So no anesthesia is done, then a spoon is used to excavate. This is a form of alternative restorative method where a minimal invasive procedure is done. And it's used for symptomless carious teeth or reversible cases or reversible pulpitis. So the caries are being removed, and minimal or superficial non-painful decay removal is performed. And a temporary filling material such as a ionomer or resin modifying glass ionomer is used, and the temporary filling is taken out of occlusion. After 1 to 3 months, the tooth is checked again. If the tooth is asymptomatic, then a vital pulp therapy can begin. So this is a very useful method because we can save teeth with this. In conclusion, it has been shown that indirect pulp therapy has a higher success rate over formocresol and ferric sulfate for teeth with reversible pulpitis and deep caries. Also, it's the most popular method amongst US dentists, and it has a higher success rate than any other pulpotomy except MTA. MTA, however, was shown not to be successful for treating reversible pipitis. And to finalize, based on the article, it was concluded that IPT, in other words, indirect pulpal therapy, has been shown to have a lower cost, a higher success on long term, better exfoliation pattern, and better success treating reversible pipitis than pulpotomy. Well, this was my presentation. I hope it was informative. And these are my references. And I thank you all and wish you a pleasant day.